switch. I just want to make two brief points, if I may, to the Minister and specifically, but also more generally. Firstly, is to thank the NHS staff on the island, thank islanders for using the app, and thank care home staff, and I'll come to that first. And secondly, I just want to reinforce some points about the fragility of health services in unavoidably small hospitals, and I'm aware that the Minister has heard it before from me, and I fear she's going to hear it in future as well. So firstly, the thanks to NHS staff on the Isle of Wight for their remarkable job that they've done, and the leadership team under Maggie, Darren and Vaughan for the work that they have done in reconfiguring St Mary's Hospital incredibly quickly, and all the feedback that I've had from staff, actually from people who've been in the hospital, is a massive thanks to all the NHS staff on the Isle of Wight. Secondly, thank you to islanders for using the sadly ill-fated app. 70% of islanders, about 75% of islanders who could download it, did download it, which to me reinforces the fact that I'm trying to develop a relationship with government where we do get to pilot schemes on the island. We know that social scientists like isolated communities to pilot schemes on. And for me, the best way to get the Isle of Wight in the front of the queue is to make sure that we're piloting national schemes. We've had 4 in the last year. The app was the most unsuccessful, although we actually ran a pretty successful test. It cost 11 million quid, rather less than the 11 billion that the previous New Labour spent on the IT system back in the early 2000s, but we'll park that for the moment. We're testing drones flying into St Mary's, which is excellent, and that drone test is going well. We are part of one of the hospitals testing the dexamethasone, if I've got that correctly, which I think has proved to be potentially a fantastically good treatment for COVID. And also we're one of the health authorities piloting the use of telemedicine, which clearly is especially important if you've got an isolated community and it is separated from the mainland by water. So thank you to islanders, but I make no apologies for trying to get pilot schemes for the island, and I'll continue to do so. Next, thank you to nursing home staff who have been extraordinarily diligent. I have spoken to many, including Belinda in Sandown and Ian Burnett as well, and I'm very grateful for their advice and the feedback that I got from many other people who are working in care homes. I did visit one that had an outbreak of corona, and it was a pretty distressing situation. And I'm very much in awe of the many people who work in the care home environment. There are a series of questions I have on care homes. I do believe that the more we can test staff fortnightly, if not weekly, the better. It would be good to know from the government when the care badge scheme was going to be launched. And the crisis in care homes has brought home, I think, the importance for us all of ensuring that our social care is fit for the 21st century. I know that is a much bigger issue that the Minister and other ministers are dealing with. Finally, on significant additional pressures to unavoidably small hospitals, there are 12 in England and Wales. She knows the facts and figures. I believe the Minister has been good enough to talk to me in the past about this. We equate the additional extra cost of running an unavoidably small hospital on an island at about £12 million a year. The NHS long-term plan, I know it set out a 10-year strategy. It says it's unable to find evidence of unavoidable costs, specific unavoidable costs, and I would beg to differ with that, because I do think we have evidence of what those unavoidable costs are, both generally in terms of unavoidably small hospitals, but also specifically in the case of the Isle of Wight. In fact, we have specifically listed and itemised those additional expenditures when compared to a hospital that has a more average-sized population. As you know, St Mary's is about half that of a normal district general hospital. Thank you so much.